Hi, it's Dr. Nelson with some post-operative instructions following your tooth extraction. So the two most important things to manage after a dental extraction is bleeding and pain control. When you leave our clinic, we're going to make sure that the bleeding is under control, but you may have to use gauze and some other techniques for a period of hours, even 24 hours following the treatment. With the gauze, one of the most important things is to have pressure on the site. If the gauze is simply in your mouth, not directly on the wound, it's really not going to do much, and it might actually cause more bleeding. So you're going to roll it up into something that fits in the space between the teeth where the tooth was removed, or if it's behind the tooth, something that when you place it in your mouth and bite down firmly, it's going to put pressure onto the wound. When you do place the gauze, after rolling it up, you're going to get it slightly damp, and just enough that the gauze is lightly damp so the dry gauze doesn't stick to the wound. At this point, you're going to place it in between the teeth at the extraction site and bite down firmly. When you're biting on the gauze, you're going to want to sit in a chair at rest for about 30 minutes at a time. Take a look at the gauze, look in the mirror with some good light, and see if the wound has stopped bleeding, or if you do see some blood coming to the surface, you're going to repeat that procedure for 30 more minutes. After 2 or 3 rounds with just damp gauze, if the bleeding does persist, a trick that works really well is a dampened black tea bag. And when you leave our clinic, you will be provided with a few of these, but any black tea will work. I'm not sure if caffeine-free works, but we generally use just like a Lipton black tea. And just like with the gauze, you're gonna roll it up in a ball, you're gonna lightly dampen it, just enough so it's wet, not dripping wet. Roll it up, you're gonna place it into the site where the tooth was extracted, bite down with some pressure for about 30 seconds. Usually the tea bag works like a charm if the gauze hasn't done its trick. For pain control, it's very important that you follow the instructions that we're gonna give you to a T. We'll give you a card. It's gonna have kind of some mild pain, moderate pain, or even severe pain, and different drug regimens to manage that. You're gonna wanna start this before the numbness wears off. Trying to catch up on pain that's already started is difficult. Staying in front of the pain is more predictable, and you're gonna be more comfortable. Most of the time we're managing post-operative discomfort with over-the-counter ibuprofen, which is Advil, or acetaminophen or Tylenol. The combination of the two works great. It actually works better than opioid medications. You can use a cold pack at the site to minimize swelling, but the ibuprofen is my favorite, and I think that's gonna keep you the most comfortable, but some people do find relief in using a cold pack. Sometimes when we do oral surgery procedures like tooth extractions, we'll place a suture or a stitch. There's a variety of types that we use. Some are resorbable, meaning they go away on their own. Others we do have to have you return to the clinic and remove. If you follow all these instructions to a T, you shouldn't have problems bleeding. Of course, if you do, you can call me 24 hours a day on the emergency line, and you're always welcome to come back to the clinic and we'll take a look and make sure everything's healing properly.